very warm welcome to all of you here. I think it is a chilly day, but we are hoping to have some very warm discussions. So I'll be moderating the session for the next 40 minutes. And if we have time, some questions after those discussions. We have a very diverse panel, I think that has already been introduced. I'll probably have my first question to Dr. Ved. As an epidemiologist, ma'am, you look at population health trends. Are there specific lifestyle diseases that you feel, particularly the people of Chandigarh and the Tri-City region should be concerned about? Ma'am.
Yeah, so thank you, Dr. Mayank, and thank you to the organizers for having me over here and in the presence of this august audience. It really is a very overwhelming feeling for me to see so many interested people, particularly considering the theme of this particular event. So yes, I'm a public health person, as I have been introduced, and we're looking at very disturbing trends, as a public health person, if so as to say, and this is not just about the Tri-City in general, this is about India in general. This is about the urban India that we're talking about. And when we look at the lifestyle diseases, we all know what these are. We're talking about hypertension, we're talking about type 2 diabetes mellitus, and we are looking at certain complications of it in the form of heart disease, in the form of stroke, that is cerebrovascular diseases, or even chronic kidney diseases for that matter. And yes, the trend is definitely increasing, and what is most striking as a public health person to me in the trend is not just the presence of the lifestyle diseases, but the speed, the age shift per se, and also the clustering of these emerging conditions. First let me explain to you when I say speed and why this is actually taking place. We are talking about behavioral risk factors as being the core or the key issue, the key concern for the rise in these non-communicable or the lifestyle diseases. And I would love to put up this question to the audience, if I may be allowed, that what do you think are the lifestyle behavioral risk factors? These are very simple ones which we can enumerate on our fingers, but there are some which we would never realize that yes, even this could be the core cause of one of these conditions. So anyone can, yes sir, please.
Sedentary lifestyle?
Right, wonderful. So anything else?
Food habits.
Food habits. What exactly do we mean by food habits, sir?
The kind of food that we...
Perfect, very nice. Anything else, Ji? Hanji?
Loneliness.
Loneliness, okay, fine.
Physical inactivity.
Physical inactivity, sedentary, yes. Anything else?
Obesity.
Obesity, again, very right, sir. So physical inactivity.
Sleep.
Sleep, very nice. In fact, I wasn't really expecting this to come out. Anything else?
Work-related stress.
Stress, perfect, sir. Stress, yes. Anything else?
Overthinking.
Very right, sir. Excellent. So let me just, if we have saturated the answers over here, let me just enumerate these for you. Physical inactivity, as you have all pointed out, happens to be the first one. Our intake or unhealthy dietary habits happens to be the second one. The third and the fourth being tobacco and alcohol. Fifth, sixth and seventh are the three important S's, of which one was sleep, the other is stress, and the third S, more importantly, anyone again? Screen time. So you can understand these are the big 7 behavioral risk factors which are actually responsible for most of the lifestyle diseases that we're looking at nowadays. And yes, I'm very happy that stress has been brought in over here. This is mental health issues. We need to integrate these. And let me also point out over here, Dr. Mayank, that what is required is not necessarily talking about lifestyle diseases, but the kind of lifestyle urban ecosystem that we have created. And this ecosystem is what we are talking about, that promotes productivity over rest. Ecosystem that is promoting convenience in the form of conveyance over movement. And that convenience which is promoting treatment over prevention. This is an age-old adage. It's not rocket science that I'm talking about. This is the basic fundamental truth that prevention is better than cure. And this is that prevention that we need to actually focus on and shift the conversation from individual blame to something that I would define as the environmental and policy based solutions. We need to have healthy urban designs. We need to have discussions like these and deliberations on what is workplace wellness. We need to talk about screening and prevention of diseases, and we need to talk about making healthy choices, easy choices. So that's just my 2 cents on the lifestyle diseases.
Thank you, ma'am. In fact, when I moved from Chandigarh to Mumbai for my masters, I remember looking at global burden of disease, so Indian study, and I remember Chandigarh was the top one in terms of type 2 diabetes, and which the reasons you have clearly understood. I mean, I used to wonder, we have cycling tracks, etc., but it's a multifactorial.
Mayank, let me add to it. If India is soon going to become the diabetic capital of the world, Punjab happens to become the diabetic state in the country. So it's definitely worrisome. Where if I'm talking about as a community medicine specialist, we, my health workers, our teams, we go into houses, even in the rural Punjab, even in the rural areas, almost every house has got a diabetic now. So it's definitely worrisome, and it is a public health concern that needs to be looked at.
I'll add heart to it.
Yes, sir.
Diabetes, I'll add heart to it.
Heart.
Heart again, I mean, Punjab is one of the topmost states where diabetes and heart is going to take it off. I mean, I'll just give you an example how people care less or how people don't even care about their own health. This is something I'm talking about 2003, 2004, when we had started the Fortis Hospital in Mohali. And in comes a lot of pressure to me through the Chief Minister's office about one Sarpanch who was coming from Taran area. And okay, that required a heart surgery. He was in for the heart surgery. He was out into the room areas in about 3 to 4 days. The fun part, we're going to laugh now. His family comes in with the food, and the Sarpanch was not eating food at all for, he hasn't had the breakfast that 3rd or 4th day in the morning. He said, "Nahin, it doesn't suit me." Lunch, he just wished it away that night. I mean, I'm going to be eating my home food. The home food was bad. Then the calls started coming to me, "Bhai, allow kar do khana." I said, "Yeah, it's very funny, how do we allow that?" His wife comes to me कि उन्होंने देसी घी के बगैर खाना नहीं खाया. So I said, he's just gone through a heart surgery. And you're telling me देसी घी के बगैर मैं खाना जाने दूँ. So I mean, there has to be basic education levels, I think, are not there or what we doing. And as ma'am says rightly, stress is a very high proportion of stress. The back of the head, may it be floods of Punjab, may it be the green revolution going on, factors multiple, the diabetes, the cancer, the heart, all goes together.
Thank you. I think, there's a lot of stress being talked about. So my next question specifically, Dr. Ahuja. You are a certified CBT wellness coach and deal with anxiety strategies. I have a special question for you. Many high achievers here might confuse, excellent performance and stress as something that are different. So, what is the clinical difference between working hard and actual burnout, and how do we spot the line?
So, Dr. Mayank, first I'd like to thank the Vibrant Forum for inviting me over, and it's a beautiful talk. So, we keep talking about stress, and sex. It's a very broad term. And we use stress very loosely sometimes also. If the kids are also using it, they are stressed out. Second class बच्चा भी कहता है कि मम्मा मुझे stress हो रहा है. And so we don't know what exactly stress is all about. So stress involves, first basic thing is your thoughts. As clinician, that I would say the thought. It starts from the basic thought, then comes the emotion, and then the behavior. So these are the 3 aspects of stress. So when we come to high performance achievers or high achievers, when I see high achievement means you have high intelligent quotient as well, the IQ is high. So high achievers usually hide their mental health under a lot of things. So clinically we see symptoms like irritability, lot of anger, lot of burnout symptoms, which we see that their relationship with their work, with their families, all going haywire, and they try to cover it up with a lot of other substances, of course the screen time and other things. So when we talk about high achievement, what is the difference and how between a high achiever and a passion driven? So with a high achiever, I would like to ask few questions. After achieving a particular thing, do you feel a sense of satisfaction or a sense of relief? There's a difference. When you're passionate about something, you will feel a sense of satisfaction, you've done something. But when you are a high performer and under stress, you will feel a relief. And then there'll be a subsequent pattern that you will follow again, that you will want to achieve something else now. This is over, now I have to achieve. So passion, when you follow your passion, you feel, you love your work, you do your work, at the end of the day you are satisfied, your sleep is good, your appetite is good, you know how much work you have to do, and then you of course perform accordingly. There is no pressure. But with the high performer, there's a lot of anxiety associated with it, there's a lot of overthinking, there is a lot of behavior symptoms and emotional symptoms associated with it. So this is a basic difference between a performer and an achiever. So yes, this is what I have to say.
Thank you, Dr. Ruby. I think I'll move on to Mr. Amardeep for the next question. You, sir, gave the example, I think something from the political side and the stress and the food habits. My next question is, I think you have had 4 decades of corporate governance experience and what happens in a boardroom. So my specific question is, do you believe health has finally become a boardroom governance issue? Or is it still treated as a personal afterthought for leaders until the crisis hits?
I would say until the crisis hit and nobody really bothered at the board levels. Indian boards, I would say, Indian employers on the boards, Indian companies, the least. The pattern is more financial, I would say, and bottom line is financial. The least is the health of the person. But the recent example which we have had is COVID. As the COVID hit, it took the boards to realize quite some time that they are getting financially hit. Boards took time till the time COVID normal happened and the COVID Delta happened. That year, the period of that time, boards did not really react so well. They only started reacting it when the impact was happening on the PLN. When the manufacturing facilities were taking a hit, when the employees had stopped coming to offices, the various kinds of stresses were happening at home. They did not even learn a lesson during the Delta. The Delta went away, the Omicron came in. The process continued. So it's very, I would say, SEBI has a rules. Government of India, SEBI has a rule, I think that happened in 2013 if I'm not wrong. And then SEBI itself says that this has to be part of governance. But in Indian companies has never been so. Neither has been so in multinationals. Very few, namely multinationals, care about the health of their people. If you say recall, I don't have a recall for other than I would say Ford US, which takes care of the health guys. Other than that, people don't care. Boards are least bothered about it. But there have been recent times the recent times that that the board has started gathering that the PLLs will be hit if the crisis come in, like the COVID happened.
Thank you, sir. I think my next question is also to you because you also have an experience with the QSR, which is a quick service restaurant or the food processing industry. Do you see the consumer landscape changing? And are we actually seeing a genuine move towards a more healthy lifestyle? Because I think there have been people here who have mentioned to Dr. Vik's question on food habits.
And I would say that it's I mean, the eating pattern in India, different states matter. But largely, we're not responsible people. We're not disciplined lot. In our DNA, whether we say Britishers pushed in our DNA in a long direction, whether we say whatever happened in past centuries, but the DNA of discipline is not there at all. The QSR industry is right now enjoying, I would say. And we are at the top of the brim. I mean, when I left Jubilant Bhartiya Group and one of our company, Jubilant Foodworks, we drumming it up very well. I mean, pre-COVID, we were extremely struggling with hardly 700 stores all over India. Today, Domino's and the burger stores of ours, etc., put together close to 3,200. And COVID was just 2 years back. It wasn't far. So the pattern really, we're not disciplined as such. We're not disciplined at all. And the people who are looking towards wellness, who give us a good food, that's expensive. Not everybody can have it. I mean, A-class cities also, there'll be low-income group people, there'll be middle-income group people, there'll be high. I mean, you take oats, you take chia seeds, you take kaddu seeds, either they're expensive there. I mean, not consumables by the, I would say, low-income group people. How much is Blinkit hitting all of these people? Blinkit is pushing into the cheese, the Blinkit is pushing in various kind of sauces, seasonings all over. It all revolves around to the behavioral pattern, and chiefly, I would say, we are not disciplined. We are not morally disciplined at all. If I recall 40 years back, whenever I was in school, we had a subject model science. It's no more there. It's not there at all. Schools feel still kind of wasted. Some of the schools had it, Doon had it till about 10 years back. That gave up, and that got finished. Sanar had it. The Mayo had it, but all it's over. Moral science is not being taught by anybody. So the small responsibilities all over. It has to look at our own parents for that. Our own parents, the kids' parents pushes it back. The burger joints are the high visiting points. Burgers cost cheap. They're very happy. Kids are very happy. Domino's today, or any pizza for that matter, is worth 200 rupees a pizza has 6 pieces. 400 rupees, everybody's very happy. So you see, this junk food is cheap, no doubt about it, but this at the same time, we're not responsible.
So this was an interesting point, sir, that you made. I remember almost 13, 14 years back when I had gone to US for some summer school. One thing that I realized was that the salad part of the food was more expensive than the food that we used to go out, and that was a cultural shock to me back then. So the cost of healthy food, except we tend to discount what we eat at home, but that was an interesting point. Dr. Ahuja, my next question to you is about your book. So, you have been the author of a best-selling book on hidden minds. You mentioned to me about that being for teen parents. So I think a lot of people here would be interested to see your answer on that. So, how does the stress business leaders carry home impact family dynamics? How can we ensure our professional pressure doesn't negatively bleed into our relationship with our children?
So that's again a very interesting question. How does stress affect family dynamics? Let's hear it from the audience and then I can take it forward. How does it affect the family dynamics? Anybody? If you're stressed, how does it affect your behavior? Irritability, of course.
Venting it out.
Venting it out, yes. In a wrong way also sometimes, yes. So when I see a lot of parents coming home stressed, and both the parents are working, the scenarios have changed now. So most of the time children are either with the grandparents or the maids and taking care of them. So there is a lot of change in the parenting style that we had and nowadays. So my book is all about, I have put on all the cases throughout so many 2 decades of my experience. This is for the parents. During COVID, I had normally common questions by adolescent parents. My child is on the screen, my child is not doing this, they are this. So everything to do with children, why do they behave? So that's why the name, The Hidden Mind. So it's what I wanted to convey to the parents is that with teens you need to be very careful when you are parenting them, because they are watching with all the children, they are watching you. As parents, you are modeling a behavior. So when you are stressed out, this is what you bring home and this is what your children will follow. If you are on the screen and if you tell your child not to be on this doesn't work like this. You know, you are watching, you are all the time on the laptop or you're watching TV or Netflix, or the children will follow that. So it has a big impact. Now with the stressful parents, what we see is the children, if I talk about first the adult behavior, there are few things in the thoughts that they are more irritable, as ma'am said, they are more angry. Every high performing stressful person will be more angry, that they will put their stress under the carpet. You know, a lot of behavior that we see, they will be not talking to their children, no communication, less of communication. And this is in their emotions, and if we see in the behavior, they will not be sleeping well, eating well, everything, and the children will be following the same pattern. So a lot, when we talk about modeling the behavior, children actually are doing the same thing as Sir said, we are following the healthy lifestyle. Now when we talk about Gen Z, we see a lot of Gen Z not taking alcohol, as the alcohol industry, we see that they are not consuming. But what they are doing is they are consuming the indirect stress that the family has, and also of course the substances that they are intaking, like weed and the other substances, but not the alcohol. And ma'am would agree with this. This is in the community health, we are seeing that. So stressful parents is bringing everything which is negative home, and the children are taking it up. So our generation is coming up with something which they are born with stress now. They are brought up with stress, and the screen is of course damaging the entire thing further. It's just like a poison.
Thank you, ma'am. I think that resonates well with a lot of one. I'm just a father to a 14-month-old, but I can see, what a lot of people would, face as the child grows. Dr. Ved, coming to you, I think as part of the first question, you had asked the audience also, what are the biggest, challenges, health lifestyle conditions that or health risks that people feel. So from the medical standpoint, ma'am, what do you feel if the audience needs to change one habit or one preventive step that they need to take to change the health crisis that we're facing today? What should it be?
I've already mentioned to you which are the important ones that we need to take care of. But yes, if it comes down to just one that needs to be taken care of, I would definitely say movement is non-negotiable. So, and it is one particular kind of a preventive habit that I would say brings the maximum returns with efforts. And here, when we're talking about movement, we need to understand that this is just basic movement, So, and the next a big thing which is doing the rounds is actually that sitting happens to be the next smoking. So everybody just needs to get up from their sedentary, wherever you are sitting. So just get up, move about a bit. And it's not even about the number of steps these days, So it's not about doing 10,000 steps in a day. It's just about doing a little bit of, say, about 200 to 250 steps per hour of your waking day. Okay, so that's just what is required. So don't keep on sitting, some kind of a movement. And if I remember very clearly, just the question that I had put up to the audience some time back, the first thing which you all mentioned was sedentary habits. So yes, and now there are so many other things which are going into my mind, which Sir has also talked about, Madam has also mentioned, and we mentioned the big 7 behavioral risk factors. Address these big 7 behavioral risk factors. Go on to prevention. This is a fundamental truth that has been passed down from generations. It's not something which I am talking about in this age. Prevention is better than cure is definitely a very important fundamental truth we need to understand. And very simple things need to be done. If you're talking about diet, if you're talking about movement, Punjab for that matter, the entire North Indian belt, this was an agrarian society, an agricultural society, right? And they were meant to be doing that kind of physical activity. That physical activity has gone, but the dietary habits are the same. So if you're talking about desi ghee consumption, there's nothing wrong with desi ghee if it is taken in moderation, right? But what needed to be done along with that, that is not being done. And we're talking about healthy food habits. Our traditional dietary habits are very, very good. What we were brought up with, I remember in our, probably we can talk about our parents also, all these burgers and everything wasn't there that time. I did my schooling in Delhi, and at that time we used to get a pizza at Nirula's for 7 rupees. Right? So here we are talking about inflation and other things, but yes, pizza used to be a one-time commodity. It used to be a one-time, indulgence that we would get probably once in a year. But now that's becoming the norm with this kind of a generation, the generation that we are bringing forward. And yes, Madam has addressed, we are working parents, we don't have time for our kids, we are not interacting with them, we aren't engaging with them. We know where we are going wrong, right? And you as a new budding parent, now at least you are in a good spot to understand that we are deliberating on these issues right now. So yes, we are role models for our kids. And what we do, our kids and the next generations are going to ape that. So we are sitting on the mobiles, in front of the TVs, no activity, coming back home, bringing our stress from workplaces back home, not moving about. And affluence has brought with it, we got educated, definitely we're in a better place to have maids and other people working for us. But that kind of brought us down to a level where we are being productive. We are busy all the time, we don't have time for rest. And let me tell you, even rest is extremely important. It's not always important to remain busy, is it? So we need to understand where the stress is coming from. So I'll just stop at that, but yes, one preventive habit, movement.
Thank you, ma'am. I think what was interesting is also rather than focusing on saying 10,000 steps a day, I think the important part every hour, 200 to 50 small goals, and I think more achievable. Thank you. I had, we have 10 minutes. I just have one surprise question also. Then we'll open it for the audience. Any questions? So, quickly, just one myth that you feel that smart business professionals have that they need to change. I know this is a surprise question, but any of you want to start with one biggest health myth that you feel that smart professionals these days have?
For me, working in mental health industry, the biggest help which is alcohol is stress reliever. So that's the biggest myth that we have. And Moment, yes, is a very underrated antidepressant as well. So we can always move our bodies. So this is my take on health myth.
No. Please carry on.
Again, it would be reiterating what I already said, bringing back your work. So a kind of the work-life balance, I believe, is most important. It is not important. The myth is, if I'm busy, I'm kind of a smart professional, No. You need to have a work-life balance. We need to have time for our families and the work getaway kind of weekends or whatever. Anything that puts rest onto your mind and your physical body as well. So that kind of a balance is important. Only work is not important.
So we have alcohol, work-life balance.
I was just about to say on the alcohol. When the COVID happened, and I just left Jubilant Bhartiya Group. So I work with Jubilant, and one of our companies, Jubilant Foodworks, which is Domino's, we have outlets all over. And each of the outlets has about 25 people, inclusive of the delivery boys, etc. Now, they are paid on daily basis. They are all like gig workers, I would say. The horror was, so when the COVID hit us, I think 25th of March onwards, to close to 30th of April, the government did not allow a single shop to be open. At least these kind of, the QSR industry outlets, Sabji and all were there. we had to put huge pressure on the government to allow us because there is employment concern, there is a generating of funds, and the more important was salary to the people who earn the daily wages. Government at first allowed us an outlet in Richmond Street in Bangalore, and then it went on all over India. But what I'm coming up is that alcohol. When the people in the Vivek sir, this is very interesting when I'm giving. When the people in the industry saw that I was able to push it into DPIIT, Ministry of Commerce, the who came behind me was Alcohol and Beverages Association. That alcohol has to start all over India. Home Ministry was completely against it. That no alcohol should be happening because that will lead to depression, that will lead to be drinking excessively, and we'll have more problems. But the pressure was too high on the government, in fact, and by then the states woke up. The states were losing their treasury, I would say, their funds. Excise builds up a good amount of a moolah for them. Karnataka again was the highest in that, in the kind of pressure. The moment the ministry allowed the opening of the alcohol and alcohol outlets, it was all over. There was mayhem, I would say. People were stocking alcohol like, there's one time opportunity. And lots of issues happened in cities like Bangalore, Bombay, Pune, the high consumption cities, I would say, of the alcohol, especially Scotch whiskies, I would say. And there were internal issues of each family. So the whole day they were doing nothing other than watching internet, other than having alcohol. They were not doing anything else.
So adding to this, anything to do with dopamine, if it is high in your neurotransmitter in your brain that we all know, it's a poison. So anything to do like screen, sitting, watching TV, alcohol, substance, any kind of a substance, so that's a poison. So there's a beautiful book on that also on dopamine. So that's my thinking.
Thank you. I think we have had very diverse, perspective. In fact, when you mentioned, you gave the example of alcohol during COVID times. I used to work with the Ministry of Health, so I had some special pass where, we can go to the office. So one request that my friends would always have is get me alcohol, not fruits, vegetables, or any other kind of stuff. That was the request that people would have who were, working at home. Do we have time for a question?
Can we open the floor for questions?
Yes.
Yeah, we can have one question, I guess. Anybody with questions for our panelists? We have one.
Good evening, everyone. Myself, Gautam Sharma. During COVID time, I was with the Trident Group and we were making ibuprofen salt as world's largest ibuprofen salt manufacturer. So I was handed over a pass just the next day. You have to daily come to the office. So my commute time decreased to Ludhiana. Considerably from 1.5 hours to 40 minutes. But again, the same point as sir raised, the only shops that were open were liquor. So, I really do fail to understand that even, in such an epidemic, is it the most essential thing? Where does, that come from? Why just the only shop in the whole commute from factory till my home was this? I wonder why. And I open it to the audience also, Why just one? No other shop than that.
Because it's a myth, no, that alcohol is a stress reliever. Dr. Bali, it affects your heart, it affects your brain. Your brain reduces to 0.01 millimeter once you take alcohol. So your grey matter also reduces. So it's not a good thing to have. So that's a myth that we can, and that's an awareness that I do it in all my sessions, that alcohol is not good. So
Thank you for sharing your perspective. I think we started with what are the biggest health risks, managing stress. And then we covered, corporate governance and stress and their perspectives. So I thank my panelists for sharing your perspectives and their knowledge.
At the same time, you should know that alcohol is not bad. I would say alcohol is happiness. Alcohol is music. Alcohol is wonderful. I mean. I did corporate affairs. I mean, my career took a global jump from 2015 onwards, and I was heading in the government affairs of a very large conglomerate. So socials every day in the evening, everybody I met internationally, the alcohol was there. And even if I was entertaining someone privately, alcohol, music, laughter, smile, I mean, these were the key factors, but alcohol does trigger nice fun in all of us. Look at Manu. I mean,
Can I take more?
see, of course, I was about to say that.